Hi everyone, hope you are doing very well. So today we will going to start hyperparathyroidism in cat. Basically, there are two types of hyperparathyroidism in cat. First one is primary hyperparathyroidism, and the second one is secondary, which is related to the kidney or nutritional disease. You see there, this one is renal secondary disease, which is totally related to the kidney. So let's start from the primary hyperthyroidism, which is not a common in cat. The secondary one is most common in cat. So high circulating concentration of parathyroid gland. Whenever there is a condition occur, it may be due to any cause. We will discuss cause later. But whenever there is a high PTH level in blood, it is termed as hyperparathyroidism. Pathophysiology. PTH is secreted by the parathyroid gland in response to change in the concentration of ionized calcium. So this is ionized calcium in the serum and cause an increase in serum calcium concentration. So whenever there is a PTH level only increase in response to the calcium. Whenever there is increase in calcium, there is increase in PTH through direct effect on bones and renal tubular calcium resorption. These are the both effect of the PTH. Okay. So next thing, primary hyperthyroidism is usually associated with the benign adenoma of the parathyroid gland. Whenever there is a adenoma, this is parathyroid gland. So next one is secondary hyperparathyroidism can be caused by a deficiency of calcium and vitamin D associated with malnutrition of the chronic renal disease. The secondary one is related to the vitamin D and malnutrition and also chronic renal disease or CKD, you can say. So these are the conditions. These are the conditions of primary and secondary hyperparathyroidism. System affected like cardiovascular, GIT, neuromuscular, renal. So let's begin from the breed. It is most both common in cat and dog. Breed predisposition, if we say that Keeshorn breed are more prone towards hyperparathyroidism. Then mean age, we say that old age cats and dogs are more suspected towards the hyperparathyroidism. Then signs, most dogs and cats do not appear ill. Whenever there is acute stage of hyperparathyroidism, dogs and cats do not appear ill. Signs become apparent when hypercalcemia is severe and chronic. Whenever there is a severity of hyperparathyroidism, then signs appear. The signs are anorexia, polyuria, polydipsia, urolithiasis. This is a, you can say that differential sign from other, because you can see polyuria, polydipsia, anorexia in diabetes mellitus, DKA like diabetes mellitus or ketoacidosis. You can see anorexia, polyuria, polydipsia, all are signs you can see in this. But urolithiasis of calcium stones are only found in this condition of hyperparathyroidism. Then stupor and coma, nervous sign like. Then physical examination finding, you find nutritional secondary disease in sometimes associated with the pathological bone fracture. Whenever there is a bone fracture and nutritional secondary disease can occur. Then cause, there these are the cause. Primary hyperthyroidism is caused due to the adenoma of the parathyroid gland. Whenever there is adenoma, there is high level of PTH and also there is a increased level of calcium, ionized calcium. Then the renal secondary hyperparathyroidism is due to the renal calcium loss and reduced gut absorption of the calcium. Any reason which or GIT do not absorb the calcium or calcium increase in the blood, so high level of calcium cause the secondarily indirectly increase the PTH level due to deficiency in calcitriol production by the renal tubular cells. The kidney do not produce calcitriol, which due to which calcium ion do not absorb by the GIT, and in results hyperparathyroidism occur. So risk factor are the hyperparathyroidism, are renal tubular disease or calcium, vitamin D, malnutrition. These are the risk factor. Then we say differential diagnosis from lymphoma, common cause to hypercalcemia in dogs. Okay, but in case of hyperparathyroidism, you see adenoma of the parathyroid gland. Then CBC find, you find high serum total and ionized calcium concentration. This is the you can differential test on which you differentiate from the total ionized calcium concentration. Okay. Then hyperphosphatemia in renal secondary hyperparathyroidism. These are common in CBC findings. Then high serum intact PTH concentration is the diagnostic for the primary hyperthyroidism. Primary hyperthyroidism is not common, but you can see rarely or diagnosed by the high serum intact parathyroid hormone. Imaging radiography can be useful to identify the urolithiasis and occult neoplasia, as well as to assess renal morphology and bone density. You can do radiography to check neoplasia or any bone density. If we say about treatment, then calcium supplementation for the secondary form, and also surgery is recommended for the removal of the adenoma from the parathyroid gland to resolve primary hyperthyroidism. Then drug of choice, normal saline is the fluid of choice for the treatment of calcium hypercalcemia. Then diuretics furosemide in only case when there is a proper hydration or when the animal is healthy one. No medical treatment exists for primary hyperthyroidism. Renal secondary hyperthyroidism is sometimes treated with the calcitriol because secondary is occur due to insufficient calcitriol production by the renal. Whenever there is no calcitriol produced by the kidney, then there is no absorption of the calcium in the GIT, and then what happen? Increased level of the PTH, and which leads to the multiple signs. Next is the expected course and prognosis. Prognosis to the end stage kidney prognosis for surgical is excellent, and it's about the. You can see like look at this. This is, you can say, a normal pathophysiology of parathyroid hormone, which leads toward the kidney, and from kidney these kidney produce calcitriol like factor, which cause absorption of the calcium into the ECF, and then it also absorb calcium directly from the GIT, okay, in the ECF. This is a normal pathophysiology of the parathyroid, and if you see like this here you see that abnormality in the bones due to the high level of parathyroidism, bone density. What happened to the bone density? So this is the primary hyperthyroidism. So next come towards the secondary hyperparathyroidism. If we talk about secondary hyperparathyroidism, high level of parathyroid concentration secondary to the chronic kidney disease, okay, CKD, it's most common cause of the, or you can sequelae of the hyperparathyroidism, secondary hyperparathyroidism, leading to the hyperphosphatemia and ionized hypocalcemia, in which we find hypocalcemia, but in primary one you see there is a high level of the ionized calcium hypercalcemia you find, but in this you find hypocalcemia, okay. Advanced CKD diminished renal tubal mass produces less calcitriol. Whenever there is a less calcitriol, there is less absorption of calcium, okay. Low calcitriol ionized hypocalcemia and hyperphosphatemia result in the increased PTH. Whenever there is a low calcitriol production, and then hypocalcemia leads to the ionized hypocalcemia, and hyperphosphatemia result in the PTH production and parathyroid gland hyperplasia. Signs are the uremia, renal osteodystrophy, or rubber jaw. This is the most common sign of secondary hyperphosphatemia, hyperparathyroidism, renal osteodystrophy, or rubber jaw. You find rubber jaw, you can see like this, the bones become like these, this kind of bone become. Cause or risk factor are the CKD. Then there is the CBC find, you find azotemia, hyperphosphatemia, and measurement of the serum PTH concentration. Then also you see calcitriol level and the calcium level. Imaging radiography may reveal low bone density and loss of the lamina due to the teeth and soft tissue mineralization of the gastric mucosa, other tissue. Then treatment, it minimize the hyperphosphatemia by feeding a low phosphorus. You should give low phosphorus diet. Drug of choice about phosphorus binders, because there is hyperphosphatemia in this condition, so you give high phosphorus binders. The phosphorus binders are aluminium hydroxide, calcium containing phosphorus binder sometimes used. Then low dose of calcitrol is also given to absorb the calcium which is found in ECF. Then maintain serum phosphorus concentration. Prevention diet should be contain low phosphorus, and long-term prognosis is guarded to the port. So that's about the hyperparathyroidism-renal secondary. So last thing about hyperparathyroidism, I want to explain this one. So this is the normal physiology of the parathyroid gland, in which parathyroid gland act on the kidney to produce calcitrol 125 dihydroxy vitamin D3. The other name of it is calcitrol. So parathyroidism produce calcitrol, which helps to absorption of the calcium from the GIT tract. Okay. Also, from kidney there is a direct absorption of the calcium in the ECF, extracellular fluid. Then also parathyroid gland act on bone for the resorption of the calcium into the ECF. So whenever there is a low level of calcium, there is a high level of parathyroid gland which try to increase the calcium level, and whenever there is a high level of calcium, then there is a negative mechanism due to which parathyroidism lows in the body. So that's all about the parathyroid gland. This is the normal physiology of the parathyroid gland. Normally parathyroid gland is indirectly or inversely related to the calcium ions. Whenever there is a high level of calcium, there is a low level of parathyroid, and whenever there is a low level of calcium, there is a high level of parathyroid gland. That's it. That's all about parathyroid glands. Thank you. Hopes if you have any question, you can ask in the comment section.